Welcome back, everyone, to my YouTube channel. For those who don't know me, my name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps non-English speakers from non-English English speaking backgrounds improve their language and communication skills and build better relationships and communication skills with their patients. Now, as I mentioned in one of my previous videos, I endeavored to get an industry expert on this channel to share their experiences in the communication space in healthcare. And this month, we have a very experienced and a very knowledgeable guest who's got a lot to share with us in this body of work, in the field of work that she is in healthcare. So, Margi, welcome aboard. Good to have you on.
Hi.
So,
nice to meet you.
Yeah, good to see you as well. This has been we've been trying to schedule this for a very long time, and I'm very glad that we finally got around to doing it.
Yes, me too.
Lovely. Well, now, could you tell us, in summary, your work experience in the field of mental health? Because I know that's what you specialize in. So,
well, essentially, I'm an accredited mental health social worker with the Australian Association of Social Workers, and I'm also an accredited clinical social worker, and I'm also an academic and have taught in both medicine and in social work. My mental health experience has covered, community-based mental health. I set up the very first treatment and rehabilitation service for torture survivors in Australia, which was a Sydney-based service. And I actually, in my practice, also supervise psychologists, social workers, who counselors, art therapists at times, drama therapists at times, who work in the mental health space and working with mentally ill clients. I mean, I guess I started out actually working when I was a very, very young person. My very first job was in a state psychiatric hospital and then in community-based mental health practice as well. So we're going back quite a few decades in the field.
Wow. And one of the good things that I forgot to mention in the beginning is that this is one of the few interviews where the time zone is very much in our favor, because normally I do my interviews either very early in the morning and very late at night, because for the people in the US. But, obviously you're based in Brisbane and I'm in Melbourne, so we're just an hour apart.
So much easier.
Yeah, 100%. So you've dipped your toes in many, many different fields in mental health. But I believe that from what I've seen on your LinkedIn profile and on your website, you specialize in trauma.
Yes.
I'm just saying this in a very broad sense.
Yes.
But I'm just curious. I just wanted to know what got you interested in specializing in trauma in the first place?
Well, look, I suppose that a lot of people in health disciplines do touch base with trauma in their work, and they don't always recognize that as a field. I guess the big foray for me was when I was setting up the treatment and rehabilitation services for torture survivors in Australia. That's a very extreme torture, trauma experiences that people have had, often over very long periods of time. And I think it's actually a lot of the bread and butter work of many health practitioners, although it may or may not be recognized. Although currently, I think there is now a lot more discussion in the mental health field about the range of mental health conditions that actually often have had trauma as their base. So it's something that I think all health practitioners and mental health practitioners need to know about. I guess from my own personal experience, I think sometimes when we've lived a long enough life, we are going to experience a whole range of things in our life. And some of those we're going to identify as traumatic to us. And I don't think any of us gets out of life totally unscathed.
Okay, that's a good way to put it. I think the word trauma, I'm going to ask you a question about this in a little bit later. I feel that people in general either have a very limited understanding of what trauma is, or and so they tend to really misuse it in many ways. They just call anything and everything trauma, or there's a lot of stigma attached to it. It almost like the people who experience it, they think that they are to blame, where they are really the victims, where it's no fault of their own. So I think I'll get into that question sort of straight away, and then I'll move on to the others. So how do you educate your clients, so be it your patients, the healthcare workers that you work with, or even organizations? How do you clear all the misunderstandings that they have about trauma, and how do you sort of get rid of all the myths that they have about this concept, just so that everyone has a clear understanding of what it is and what it isn't. So I'm just curious to know, how does your work actually reflect that?
Well, I think you're right. I think there's been in the mental health field, there's been a range of kind of different sort of definitions in the various diagnostic and statistical manuals from the American Psychiatric Association, and over time there's been sort of different emphasis placed on trauma and what it actually means. But I think your question about how I define it in different ways with the different groups of people I meet with. I guess with clients, I have developed my own process on how to do a trauma assessment, quite a trauma timeline assessment, quite early in the piece. So with a client, I'm actually asking them to sort of just give me the names of some of the things that have happened to them that they believe is trauma. I think one of the things that happens is many people kind of go, they tend to think that my trauma or that person's trauma, there are degrees of trauma, and some are just much worse. And I try to emphasize to people, no, it's how it's impacted you that's important, how it's impacted you in your life, in your relationships. With my people that I see, because I supervise clinicians with their work as part of their continuing professional development points. And with them, I guess I tend to attract many supervisees who actually have had their own experience of trauma, and they may also be working with trauma survivors. And so I think that kind of leads to the person being impacted at many levels in their work, and sometimes just helping them to have an understanding of are they reacting this client out of their trauma, or are they acting this client out of what the client's presenting? And in terms of the work with organizations, I think it's that very often organizations are not aware of some of the systems that they have in place and the impact they have on when someone who is traumatized walks into a building or into a room.
Right. Mm-hmm.
For example, if someone has been, for example, if someone has been, beaten by somebody walking behind them, if you're walking behind them, walking down a hallway in a particular center, they're likely to be a little bit more agitated by that.
Of course, yeah.
So becoming very, very aware of some of the behaviors that we can have as clinicians, being very, very aware of our own behavior in the setting with other people as well. But I think you are right. People don't understand that trauma is something that has happened to you that's changed you in some way.
Yes.
That it's like, the word trauma is more like a sort of a cut in the skin and we have to let it heal. Well, psychologically, that can happen as well. And I think the other part of trauma that people don't often understand is that a lot of trauma symptoms get sort of captured in the body through your senses. I had somebody in my room quite recently saying, had a fight with a young person in their family. And when I asked this person, well, what else, when your daughter talks to you like that, or when your son talks to you like that, what other memories are coming up for you? And the person had a whole string of experiences that had happened to them earlier in their life, which were very traumatic ones where they were humiliated, and that was what was being triggered.
Yeah, what it really got me interested in what you just said, because a lot of people, this is I'm slightly going off track here, but I'm just offering my thoughts. A lot of people, they go into parenthood without understanding or having any awareness about what were the things that may have changed us, like you said, or left an impression on us, and they don't necessarily are even aware of it to get the help to deal with that so that it doesn't get passed on to their children or it doesn't show up when they are parenting.
Yes.
And I can say this because as a woman, I've chosen not to have children. And now this is not my reason, but a lot of women I know because I know a lot of women like me who are child-free by choice. And the one reason, a very common reason that they tell me is because there is generational trauma. And
Yes.
they don't want to pass that on they want to focus on healing that themselves, and they do not want to pass that down to the next generation.
Yes.
And that's what I always, I've always said at the back of my mind, like, people, when they're doing something really significant, like even, we don't even have to go into parenthood. It can be when you're starting a relationship, when you're even starting a business, or if, say, what's another big significant event? Yeah, so these are the situations where, all your past trauma and everything does resurface at some point, and you may not even be aware of it,
Yes. However, I do think we can become aware of it,
Yeah.
and I don't necessarily prescribe to the view that once you've had trauma that you have that forever in your life. I
Yes.
think that nowadays we have a lot more understanding of how trauma impacts people. There's a whole range of therapies that are including psychotherapy that can be very, very helpful. There are body work processes that can be used, and so people don't, or I just don't think people have to live with the victim of the victimhood of their
Sure.
story. And I often like to see it in the context, there are people who get stuck in this trauma story and they're almost a victim of it. There are people who can move out of it and become, and often develop a new identity as a survivor of trauma. I actually think that we can actually go beyond that. We know that there's such a thing, for example, as post-traumatic growth. We know that trauma experiences we have can actually make us better people, and to some extent.
Yes.
But I like to put it into the context of, in what way are you thriving or not thriving in your life? And I think that's often a much more positive way to look at it.
Yeah, and I can understand why your company of one is now named Thrive Beyond Trauma. So
Yes, yes.
yeah, it puts a good positive spin on it, and obviously, it's because being stuck in that victim mentality, it just keeps you stuck in overall. So it's
It does.
important to sort of push past that for sure.
Yes, I think, but I also think it's actually very, very difficult for many people from different cultural perspectives.
Yes.
For example, I grew up, I'm dating myself, but I grew up in post-World War II Scotland.
Right.
Now there were laws in the Scottish Parliament, for example, that had, what was this? That basically had a law that a man could beat his wife, and what he was not allowed to beat her with, or with the size of
Wow.
stick,
Okay.
and this kind of thing. So I think that there's often a lot of experiences that people have had where they just go, oh well, everybody was treated that way. Yeah, that's true, everybody was treated that way, but also not everybody was treated that way from
True.
that
Yes.
particular cultural group.
Yes.
So there's both. So I think we have to kind of weave through, what the meaning is for the person themselves. And you're
Yeah.
certainly right. There is quite a lot of work at the moment around intergenerational trauma and how that impacts people. And but understanding your family history about that can also help us to be more compassionate with ourselves about it too.
Absolutely. Yeah. Really good. Oh, well done. Now, so how are you equipping your colleagues and subordinates on how to better communicate with their clients? There's two ways. I'll ask the first part of this question. To sensitively communicate with their clients who have experienced some sort of trauma. What sort of skills and strategies do you think are the most important in doing that communication?
Well, I think it's important for clinicians to have an understanding of trauma. And it's also important, I think, for clinicians to also be reflective about their own experiences. I think sometimes it's important for clinicians to actually go into therapy as well as being a good clinician. I think, because often, we can learn from being on the other side of the
Totally.
couch or
Mhm.
whatever it is to some extent. You know, I think it's when I work with a client or a supervisee who is working with trauma survivors, I think it's with the clinician, it's finding out what are some of their stuck points around the work that they have. What parts of the trauma story are they finding it hard to listen to? Do people have to listen to every single bit of the person's trauma story? We now have some methodologies that we use with clients where, you know, the person doesn't necessarily have to tell the whole story. I personally think that it's probably useful to talk about parts of the story where the person feels the most shame and guilt, because that's the part that
Yes.
kind of, you know, closes our hearts to ourselves a
Mhm.
little bit. With clients, though, I think it's often a lot of psychoeducation.
Right.
You know, people, um, you know, a lot of psychoeducation and a lot of reflection on their experience. And sometimes it's quite interesting that when I do a trauma timeline, which is something I also teach to my clinicians, when I do a trauma timeline with a client, I'm sometimes really surprised at what they say it was the most traumatic event for it. They might have experienced a lot of things, like, you know, being involved in a holdup, or you know, having a parent suicide, or
Yes.
you know, things that we would say they're traumatic events, but for them it might be something totally different. So I think it's being able to be kind of non-judgmental. It's
Yes.
being able to listen.
Of course.
It's
Yeah.
being able to enable the person to feel safe to tell the
Absolutely.
story. You know,
Absolutely.
you know, I've had people come in and sort of, they'll come into the room and they'll sometimes say, well, I've had some terrible traumas, but I'm not going to tell you about it. And I go, well, that's okay. So let's work on let's look at why you're here, and, you know, what you think I can help you with. And it might be sleep, or it might be anxiety or depression that they may present with, but usually within the first 2 or 3 sessions they've told me what the trauma was.
Yes.
You know, so I think
Yeah.
clinicians sometimes, I think, get afraid to hear the story if the
Okay.
client wants to tell it. And I think there are ways that you can engage the person in telling the story, in ways that the client doesn't get overwhelmed by telling it,
Sure.
and you don't get overwhelmed by hearing it.
Okay.
And
Well.
so the part of the skill that I focus on with many clinicians is how not to be overwhelmed
Oh, okay. That's a good
as
one.
well. Yeah.
Yeah. That actually brings me well into the next question. So, what I saw on LinkedIn, this was, sometime last year, that, a lot of clinicians, obviously, and anybody who's trauma survivor, who's experienced trauma in the past, they are now working with their clients who have gone through a similar journey. And in the process, what can happen is that for the clinician, their past trauma resurfaces during those sessions. That's quite a
Yes.
common thing.
Yes.
And at that point, how do you think clinicians should, or rather, how do you support your clinicians or your client base on how to manage their individual triggers while delivering a supportive experience to their clients personally?
Yes. Look, I think that's a complex field. I mean, there is, you know, a terminology called secondary victimization,
Okay.
which is often applied to people who work in the trauma field. That your view of the world can change because of the work that you're doing, or you can actually, you know, because you're hearing stories all the time, that not only you can become traumatized by that, or it can trigger previous experiences that you've had yourself. I think it's really important that clinicians know themselves well, and this is where, you know, going into therapy, you know, can be helpful for that. I think that sometimes what often happens in a clinical interchange is that sometimes the person's whole trauma story comes out in one big amount and it's, too big for the clinician to handle. It's often too big for the client to tell, or the client afterwards feel really bad that they told all this story. I think
Sure.
it's much better to go into it in a much slower way. And that's why in the trauma and the timeline assessment that I kind of do, I just say to people, look, I just want to know what, from the time that you were born to the time that, your age you are now, let's just name some things that you think are traumatic. We're not going to get into the story. Because we also know that when someone who's been traumatized is in their trauma story, they're not using the healing part of their brain. They're using the
Yes.
logical, journalistic part of their brain. And I think sometimes clinicians don't always understand that there's those two different ways that people tell their trauma story, or many different ways that people tell their trauma story. I think for clinicians, look, we know that having a lived experience can be very helpful, because it gives you some, I guess, some sensitivity, but it also can be a risk for us as well as
Yes.
clinicians.
Yes.
So we need to have our own ways of how we debrief ourselves from that. Now, I often find that, clinicians will say to me things like, oh, I've got lots of self-care in place. I go running, I do exercise and all that kind of stuff. And that can be very, very helpful. But there are also many ways that we can kind of have time with ourselves between clients, or being, reflectively writing about it for ourselves, or drawing, or just finding ways that we have more self-care. For example, one of the things that happened for me personally when I was setting up the torture and trauma services was I kind of realized that I was dealing with people from war, people from violence, all sorts of, and it was pretty constant. We were working with, people from up to 100 different ethnic communities who'd had these kinds of experiences. And so I made a very strict boundary in my home. I didn't watch documentaries about aspects of my work in my home. I
Fair
didn't
enough.
watch, war movies in my home, which I
Sure.
normally would have maybe looked at before. But, finding ways to kind of have boundaries around ourselves and around our work. And I think too, when a clinician is able to notice when a client is becoming activated, and also to notice how to how to calm a client, how to slow it down. That's also helpful for the clinician in that moment as well.
Okay.
Because,
Well,
we know that, through the power of mirror neurons, that if I'm calm in the room, there's a big chance that that's going to be felt by the client, and that's going to help
yeah.
help them calm. And so there's a broad range of tools that we use with clinicians and with clients to manage that situation.
Interesting. So I love how well the questions are actually flowing just based on all the responses that you're giving. And this is a question that, I personally, I can sort of vouch for it, that, people, and personally for me, I always feel like I can trust a clinician or anybody, or a coach or anybody who have actually been there and done that, if when they are trying to help me or support me. But my question is that, do you necessarily have to have experienced trauma firsthand in order to be good at a role like yours? Or do you think our clients tend to trust people like the ones who have experienced trauma before, who've been in their shoes, or the ones who have, or the ones who are just, have the accolades and are textbook warriors, and they feel that they have more credibility? Well, what are your thoughts on that?
Well, my thoughts are, look, I think you're right that often clinicians do like, often clients do like to go to someone who they think that person will know. But in actual fact, it's impossible for us to know everybody's single experience, and I think that's putting too much weight on ourselves. I think that there's lots of ways that we can learn to develop empathy, to develop the capacity to listen, to develop the capacity to be present with. There's lots of ways that we can learn that in our life, not just by going through it. We can learn it through movies. We can learn it through literature. We can learn it through, imaginal exercises of putting putting us, having thoughts of that, and a lot of reflection during training programs, where we can begin to sort of begin to hone in. What would that be like for me? And that might be different for this person, but at least the fact that you're asking yourself that gives a little bit of a clue. So I don't think people have to necessarily have gone trauma. I'm still waiting actually to meet someone who in 3 generations in their family, they've never had any trauma.
Yeah.
I am pretty sure that if I did a 3-generation family tree of anybody, I will find some of the trauma that has been in that family.
Fair enough.
So I think that often we're not aware of some of the trauma that we may have
yes.
been passed down, or that
Yes.
has impacted us. And so I think in clinician training, if that is kind of focused on, I think that can be very helpful.
Yes. I mean, obviously the coaching that I do, I really help my clients, develop active listening, empathy, and all these little skills. And this applies to everybody, anyone working in healthcare. So I'm very pleased to see that those concepts are being brought up in this conversation as well.
Yes.
And just finally, what changes have you witnessed in recent times about the source of trauma, that, the leading causes of trauma amongst your clients and colleagues, compared to when you first started working, and possibly in Scotland or in a different country? Have there been any changes at all, or do you think it's more or less the same?
Well, I think generally people are more comfortable with the trauma language.
Okay.
I think people are often a little bit more ready to identify that I've been traumatized. In fact, clinicians will say to me, well, your niche is sort of, I'm attracted to you because you've worked in trauma, but I'm also attracted to you because you've really identified that you work with workers who are trauma survivors themselves as well.
Yes.
And I think that's quite important. Look, I think the whole world has been in a bit of trauma, since COVID times. And certainly, it's kind of interesting that the impact of some of the COVID stuff for people is around that. My parent died and I couldn't be at the funeral. I couldn't go there. Or it's around, ways that people felt excluded from their work, or felt humiliated because they didn't have any vaccinations.
Sure.
I think it's also being a bit traumatic for people to just learn how to socialize again.
Absolutely.
So I think those are some broad things. I certainly think that this what we see on the media, what's happening in Gaza, what's happening in Israel, what's happening in the Ukraine. I think people do get very impacted by some of the presentations of what's happening on media, and people can have some people can develop a sense of feeling safe or not feeling safe, or yes, I've lived through something like that before. And so, it can be triggered by a whole lot of things.
Yes, 100%. And so there's definitely more. I think as a generation now, we are much more open to these things, having these conversations, that it's not as stigmatized or tabooed anymore. Although, like you mentioned in the past, just a while ago, about how in certain cultures it's still very much, pushed under the carpet. And, the culture that I come from, Southern Asian, it's very, very good at doing that. The big issues are just not talked about. And in fact, I can say that till I was the one who started to go to therapy, who started to display mental health challenges, no one in the family talked about it. So
yes,
I was the only person, because I'm the only person in my family to go to therapy. So then, in the process, I have realized, in my journey of therapy as well, that, oh, these are the reasons why my mom made this choice. These are the reasons why my dad does this, and I'm able to connect the dots together. But obviously, growing up, we never had this conversation with our parents, or no one in the family even got together and had these in-depth, or these kind of situations where they really are put on the spot to really reflect. The other thing also is, what was I going to say? So obviously, there's that one thing, which is, you have to be very, very self-aware also, but also in my culture, overall, compared to other parts of the world, mental health is still a thing that that is very, very hush hush, and people just don't talk about it.
Yes.
And there's a lot of misinformation, especially the older generations, whereas the younger ones, we're just really having a push to have more open conversations with our loved ones, and just so that collectively. Now, this one actually does manifest in much more dysfunctional and unhealthy patterns in some other families from my culture, where there has been a lot of abuse, there's been violence, and there's been addiction and things like that. So whereas in my family, there was, the baseline level is relatively stable, but there are certain sources of trauma that have impacted at least my parents and also some of my extended family members as well. So
Yes.
yeah,
And I think sometimes in organizations, because many organizations are looking at how they can support people with mental health issues better in their organizations. But trauma in some ways is not a mental health issue. It's something that has happened to someone. And yes, it has some impacts. And yes, some of those impacts might lead someone to be more anxious and depressed. But I think it's really important in organizations that there be aspects of normalizing people's experience and being receptive to hearing about it. I think that sometimes in some organizations, someone might have been publicly humiliated in a meeting. No, you
Fair
don't.
enough.
If you're behaving, we know that that's not good management practice, but
Of course,
but if that happens to someone in a meeting, you don't know what else it's going to trigger. I was recently in a conference in Dubai, in which there was a presentation on trauma as part of the health stream of that conference. And one of the things that intrigued me, it was many people from around Middle Eastern area and Australia, and people from all. It was an international conference. And it was interesting to me that people in the well-being field, people who are massage practitioners, people who do energy medicine, that they're becoming now more interested in trauma, recognizing that often people have learnt have learnt to do what their craft is, but haven't ever been taught, like, what is trauma? How do you know when someone's traumatized?
True.
In what way are they likely to shut down?
Absolutely.
What are some of the sensory things that may happen? So I think that there's just being able to educate and talk to people about most of us will experience it at some point in our life, or if we haven't, we're lucky, but certainly our parents and grandparents did.
Definitely, yeah. I think we've just about hit the time to wrap up now. So where can people find you? Can you just tell our audience?
Well, my website is www.thrivebeyondtrauma.com. My email is margi@thrivebeyondtrauma.com, all one word. And certainly I can provide my phone number, which is +61 455 503 315.
Okay, I'll leave as many of these things in the LinkedIn description box as well as the YouTube description. But yeah, this was a very, very insightful and in-depth conversation, which I thoroughly enjoyed. And it just seemed we had so much in common and we gelled really well. So thank you very much for your time and your wisdom and your knowledge that you shared with us. And to everyone watching, make sure that you hit the subscribe button and the notification bell to get interviews like this, as well as other content on a weekly basis. And also, if you like the video, make sure that you hit the like button. And I will see you during our next video in the future. Thank you very much.